Hello, in this video, I'm going to tell you all about the different types of cartilage. So briefly, cartilage is a type of connective tissue that's made up of densely packed collagen or elastic fibers mixed into a chondroitin sulfate, which is a rubbery component of ground substance. So the chondroitin sulfate is what makes cartilage have that kind of solid but rubbery, flexible kind of texture to it. Chondrocytes are what we call the cells of mature cartilage. Cartilage has no blood vessels or nerves. So when we tear cartilage and it hurts, it's not the cartilage that hurts, it's the surrounding structures that are hurting because of maybe the debris or the cartilage might be pulling. That could be the joint capsule, ligaments, other structures that are part of a joint, for example. So it's not the cartilage that hurts, it's the bone and everything else that is affected by the damaged cartilage. Because cartilage doesn't have blood supply, that also means that it heals very poorly. As a general rule, tissues in the body that have a good blood supply heal more easily, and the less blood that tissue receives, the less likely it is to heal on its own. And so that's why damaged cartilage, often we just have to live with it. And if it gets bad enough, then it might be worth surgery to repair or correct whatever the problem is. But cartilage, generally speaking, just doesn't heal very well by itself. All right, so we have three types of cartilage. I'm going to go through each one. First is hyaline cartilage. Contains a resilient gel as a ground substance. So this is a very slippery, smooth, gelatinous kind of cartilage. When we actually dissect and look at it in the body, it has kind of a bluish-white appearance and it's very shiny. Has a lot of collagen in it, which is what gives the bluish-white shiny appearance. It's the most abundant type of cartilage in the body, so we have it in the most places compared to our other two types of cartilage. It's also the weakest type of cartilage compared to the others, and it can be fractured. So where we have the most hyaline cartilage is at the end of long bones where they form joints. So where they're forming articulations, we have hyaline cartilage because it provides a smooth surface so that we're reducing any kind of friction between those bones. But in addition to in our joints, we also have hyaline cartilage at the anterior end of our ribs. So in the front of the rib cage where it's connecting, where the ribs connect to the sternum and where some of the ribs really just connect to each other. We also have it in the nose and parts of the respiratory tract and in the embryonic and fetal skeleton. So again, the function is to provide smooth surfaces, flexibility, and support, primarily with our moving joints. Fibrocartilage is our second type. It consists of chondrocytes, meaning cartilage cells, scattered among thick, visible bunches of collagen fibers. So we've got these big, dense collagen fibers bundled up that are going in the same direction so that we have tensile strength going in the same direction. And so this is the strongest type of fibrocartilage, and it's used to connect different structures and joints together. So we have fibrocartilage at the pubic symphysis, where we're attaching the two pubic bones together in the front. It also makes up a lot of our intervertebral discs. So like a portion of the intervertebral discs makes up the menisci of the knee and portions of tendons that insert directly into cartilage. So we have fibrocartilage in places where we need very dense, very strong, rigid cartilage to attach two things together. Okay, our last type is elastic cartilage, and it's exactly what it sounds like. It's stretchy. It's made up of chondrocytes in a thread-like network of elastic fibers. So our collagen fibers are thick and dense and strong. Elastic fibers are much thinner, much more delicate, and they're stretchy instead of strong. So we've got chondrocytes in a thread-like network of elastic fibers. So we have this anywhere where we need a structure that is strong, like where we need it to be stronger than other types of connective tissue, so more on the solid side, but also elastic and flexible. So we have it in the epiglottis, the part of our external ear, this flexible, stretchy part of the external ear, and in your auditory tubes. That's another name for the Eustachian tubes. So it provides strength and elasticity, but also maintains the shape of structures like the external ear, for example, or the tip of the nose. All right, thank you so much for watching this video, and I hope you have a great day.